we are covering airborne precautions, which are essential to master for the NCLEX because they represent the highest level of respiratory protection. The exam will expect you to know exactly which diseases require these measures. The main ones to remember are measles, also known as rubiola, tuberculosis, and varicella, which is chickenpox. A great way to remember this is the mnemonic NTV is on the air, which stands for measles, TB, and varicella are on airborne precautions. Disseminated herpes zoster also falls into this category. The NCLEX tests your understanding of the science here. These pathogens are transmitted by tiny droplet nuclei, smaller than 5 microns, that can stay suspended in the air for extended periods. This is the key difference from droplet precautions, a common point of confusion and a frequent exam trap. For your exam, you must associate airborne precautions with a specific set of interventions. First, the patient must be in a private room with negative pressure airflow. This means air from the hallway flows into the room, not the other way around, preventing infectious particles from escaping into the hospital environment. This air is then vented outside or passed through a high-efficiency particulate air, or HEPA, filter. An exam question might ask you to select the appropriate room for a newly admitted patient with suspected tuberculosis. The only correct answer is a negative pressure isolation room. Next, let's talk about personal protective equipment, a huge topic on the NCLEX. Anyone entering the room of a patient on airborne precautions must wear a fit-tested N95 respirator. A standard surgical mask is not adequate and will always be an incorrect option for provider protection in these scenarios. The exam loves to test this distinction. For example, a question might describe a nurse preparing to enter the room of a patient with measles and offer 4 PPE options. You must select the N95 respirator. Remember that fit testing is mandatory, usually on an annual basis, to ensure a proper seal. If a question states a nurse has not been fit tested, the correct action is to assign a different fit-tested nurse to the patient's care. Patient transport is another area ripe for exam questions. If the patient has to leave the room for a procedure, they must wear a regular surgical mask. This is a critical point. The N95 is for the healthcare worker entering the room, while the surgical mask is for the patient leaving the room to contain their own respiratory secretions. This is a common exam trap that tests your ability to apply the right protection to the right person at the right time. Similarly, visitors should be limited, but if they do enter, they must also be instructed on how to wear an N95 respirator. Finally, never place an immunocompromised patient in a room with a patient who has a known or suspected airborne infection, as this would be a catastrophic failure in patient safety that the NCLEX will expect you to prevent.